Hello everyone, I am back with a part two as promised, and this time I'm going to be going more into depth on the things that I have used during my jaw surgery recovery, as someone did reach out and ask me could I go into it more than the little brief things that I had talked about in my first video. So let's get into it. Of course, first and foremost are your ice packs. The ones that I would really recommend is this one because these are gel packs instead of the ice packs, and these one can really conform to your face how it is. That's why I really prefer these out of the simple ice packs that they give you at the hospital. I like these a lot. I kept two on me where you could normally wear two at a time, and then I always kept the other two in the freezer. So whenever I swapped them out, I always put the ones that were in the freezer on the wrap, and then I'll put those two back into the freezer. So I always had ice packs on the clock 24/7. And even when I wasn't wearing the head wrap, like if I was going to a doctor's appointment or I just wanted to get out the house for a second, then I would even have my head wrap in the freezer as well, because your ice packs and things like that are the most important part of your jaw surgery recovery. So it could help really seriously with the swelling and things. But I have really appreciated this. I even still wear these every so often to now, and even though I'm a year post-op, I still wear it now because sometimes I still do feel like I get swollen in some places than others. But I have worn these for a long time, and I really do enjoy these. You can get these from Amazon. Even you can get them in different colors and things for yourself. But I would highly recommend this kind because it really conforms to your face better than just simple ice packs. And next and foremost is your syringes. Like I talked about before, I had three. I had one that I used for water, I had one that I used for medicine, and I had one that I used for juices or soups and broth. So I really didn't want to cross them too much between each other because they can be hard to clean. So that's why I kept three separate ones for three separate things. Next is the humidifier that I had. This is the actual humidifier that I bought during recovery. I loved it so much that I ended up buying two of them. I got these from Lowe's. Now they are a bit pricey. It is $100 for this specific humidifier, but I really liked it because the tank in the back is over 1 gallon. I think it was 1.3 gallons, and it comes with a remote. And with the tank being as big, I didn't have to replace the water for about every 2 days. Even I kind of kept it running around the clock to help with the air that I was in, because the house that I was in during recovery, the air was a lot dry, but this really helped with keeping my nose clear and things. I had to learn to put it on the floor in front of me instead of having it right next to me, because every time I would go to sleep, my face would kind of lean towards the humidifier and I would have more swelling on one side than the other. But this was really grateful that I ended up buying two, and I really liked it because it came with a remote. And it was extremely quiet. Like you would hear like just little bits of droplets of water and things like that. But other humidifiers, you can just hear it running. But this one, you don't hear it running at all. So next is the face roller that I had. I bought this from Macy's. I can't remember how much it was, but it was really nice. I always set this one in the freezer because it helped with swelling. Like I talked about before, I would end up leaning one way sometimes when I was sleeping, especially since being up in a recliner. And this will help really even out my swelling at times, especially with using it and it being cold. Here is the baby spoons and the baby toothbrush that I use. The baby spoons, I ate a lot of, like I talked about before, oatmeal and broth and things. And so my surgeon was fine with me having this. And so I had to get baby spoons instead of using regular spoons because I couldn't really open my mouth as well, of course. And these were the baby toothbrushes that I used. I got both of these from Amazon. And the baby toothbrushes were really nice because you're really going to want soft bristles and things like that on your face, on your teeth and things, because you are really sensitive. And so your normal adult toothbrushes aren't going to be as comfortable in your mouth as a baby toothbrush, especially how small the head is for yourselves. And next you can see here, these are the neck pillows that I had. I actually bought two for me because when you have the surgery and how swollen you get, your neck gets really tired. So I had a regular travel pillow that I kept on the majority of the time, and then I had this heated massaging one that really helped whenever my neck started to cramp up and things, because I really couldn't, you can't really lay yourself down or you have like a lot of discomfort in your face. So I needed something to give my neck that break or comfort that it needed. So these travel pillows I would recommend for anyone having this surgery, because your neck is going to get tired from how swollen you are and you constantly sitting up. And I would recommend hand towels as well to go around your travel pillows, because when you are eating, sleeping, and things like that, you cannot feel if something falls out of your mouth because you are so numb. Your lips are numb, your chin is numb, so you can't feel anything falling down your face. As you can see in this picture, I don't know what that is on the side of my mouth, but I could not tell that something was there. And so, like when you're sleeping and your mouth is open because you can't really keep it closed properly, you'll be drooling and things. And then drinking through a syringe, sometimes you can't feel it in your mouth as well because the inside of your mouth is numb too. So, I would really, really recommend hand towels to people, especially like if your mouth is going to be bleeding as well because of the stitches on the inside. Now, here are the wedge pillows that I've seen some people talk about on Reddit or other YouTube channels about their experience with jaw surgery. And looking at the reviews of these are really nice. These are more mainly for people if they're going to be staying up in a bed and not like a recliner like I was in. So these don't typically get like flat like pillows do, where you have to take it from behind you, trying to fluff it and things. These will generally hold their place. So these are ones I would recommend to anyone who can't stay up in a recliner but have to stay in bed. Now, I've had someone reach out to me about pill crushers. This is the one right here that I would recommend. What you would do is you would unscrew the pink top and you would put the pill on the inside and you would just grind it up. Because I know some people have reached out to me saying that, they're by themselves. They don't have someone helping them. So they're trying to make it the easiest way possible for them, which I was like, wow, I can't believe that, there's not somebody helping you and things, because I feel like this is kind of a bit difficult to go by yourself. But these pill crushers are really nice. You can find these on Amazon as well. Now, for me, I am a big chapstick Carmex user, but I'm mainly more of a Carmex person. But for recovery, when I tried to put Carmex on, it would burn my lips, like especially like in the corner. I don't know if it's just because of the medicine and things in it. So I had to switch over to using chapsticks. I bought this pack right here, this moisturizer 2-in-1 lip care from Chapstick on Amazon. It did come in a 3-pack that I used during I used it for about 2 months before I was comfortable actually putting Carmex on my lips again, even though I was still really sore on the corners of my lips for about 6 months. That's when I had went back to using actual Carmex and things, because I'm a big, big Carmex user. Here is the picture of the water bottle that I specifically had. I will post a link to it. Someone did make it for me. And so, because there were times where I would get tired of using a syringe. I didn't feel like grabbing it, pulling it up, and things. I could just have it in a water bottle that was simple, easy to grab. And so this is something I do recommend for people to have as well, especially when you get to the point where you can start having some feelings in your lips. But this one I could just throw it back easily instead of like having one of those squeeze bottles, because I did get tired of using the syringe at times. Most people, you'll get tired of using the syringe constantly and things, so you will start switching it to other things to use for yourself. Now here, I posted a dry erase board. I went to the dollar store and got this. I preferred having a dry erase board for my first couple days post-op because I was really uncomfortable in the face, didn't really want to move or talk and things like that. So it was really easy to just communicate on a dry erase board versus trying to use like pen and paper, because I really didn't want to waste paper. And so I had went and bought a dry erase board for myself to have like simple messages, if I needed some medicine, if I wanted some water, from food and things like that for myself. So I would recommend this for a simple way to easily communicate with someone on things that you need. Another thing that I would deeply recommend is button up shirts, because that really helped me. Because sometimes pulling things over your head, especially like when you're really swollen in your first week, is really uncomfortable. And I didn't want to stretch out the necks of my shirts, because it does really start to look not so nice over time. But I would really recommend button up shirts for anyone who is going through this. Well, everyone, thank you for watching. Please like, comment, subscribe. If you have any questions, you're more than welcome to leave them in the comment section. I do reply and I do watch my comment section. A new video will be posted shortly, part 3 for jaw surgery, so be on the lookout for that. Please be safe. If you're about to go through jaw surgery, just know it'll be okay and you'll be fine.